most men really want to try to assist their partner and are very happy to embrace the interventions that may be required. So mild male factor infertility, it is common. It is common. Work that we have published looking at even young men in Western Australia show that actually young men from a normal population, actually a significant number of them will have sperm parameters that don't meet the World Health Organization minimum standards. So it shows that male infertility or potential male infertility is very common. So what can we do about it? Well, as I said, many men want to try and help. So what can they do to improve things? So often simple things like getting healthy, to eating well, certainly no smoking, moderating their drinking intake, so perhaps just a drink a day rather than saving it all for the weekend and having the big blitz at the weekend. Certainly no smoking or marijuana use. These are bad for sperm. A very sedentary lifestyle is probably not ideal for the testicles. Effectively sitting on the testicles all day is cooking them. They're on the outside of the body for a reason, to keep them cooler. So generally some simple lifestyle things can substantially improve sperm parameters. If they've got a concurrent medical condition, improving that. So beyond that, we're presented with a man that appears healthy and he's got a suboptimal sperm parameters. What can we do? Well, if that's basically due to an obstruction and that's he will have no sperm, obviously the common situation is a vasectomy, just simply bypassing that pipe is relatively straightforward, and that's a procedure of testicular aspiration or TESA, aspirating the sperm. Unfortunately, a man who's got testicular damage, he may have a genetic mutation which leads to an abnormality in sperm production. He may have had chemotherapy previously. He may have a condition called Klinefelter's syndrome, a genetic condition which is associated with very, very poor sperm production. So if he has very, very poor sperm production, unfortunately, just sticking a needle in the testicle is actually, not only is it not appropriate, but it's actually also potentially harmful. He should have a procedure called micro-TESE. And that's the subject of another video presentation, but this is a procedure which is only offered in very few specialised centres in Australia. It requires great surgical expertise, and here at Fertility Specialists we have very good success with that, with Dr. Perkins performing this as a trained operator in this field. So that's micro-TESE for the man who has what we call testicular failure. Now, other causes, well, we've mentioned that potentially there can be some central causes which actually the drive from the brain is not actually activating the testicle. And this is often one of the most rewarding situations. The man really feels that him embarking on the journey of infertility treatment with his partner, he really is getting involved and potentially can help her conceive naturally, whereas they initially come and see us and they think that they're going to need IVF with ICSI treatment. But correcting this central problem can lead to natural conception. So in this situation, the man's drive from his testicles, we call luteinizing hormone, follicular stimulating hormone, are very suppressed. Normally in the body, we live in a sort of a balance, and when the end organ isn't responding, the central organ responds to stimulate it. But for some reason, in this situation, it doesn't work. So simply, we just give these drugs, and waiting a few weeks, the man's usually getting a bit impatient, nothing's happening, and then with time he'll notice his testosterone increases. Potentially, if he's paying attention, his testicles might slightly increase in size, but with time his sperm parameters will improve. So it's a marvellous treatment because he's involved in assisting his partner getting pregnant. He starts to feel a lot better, his testosterone improves, and I've seen many men who the GPs have put on antidepressants, and actually it's not depression. They've actually got a low endogenous testosterone level. And improving this, they notice their body shape changing. Their partner notice their behavior and it has changed. They've got seem to have more energy, more motivation. I call it like joie de vivre. They feel a lot more positive, and they often, I can think of countless patients who are just so delighted at the way they feel so much better. And that is obviously then compounded by the chance that they potentially get their partner pregnant naturally. And I've many patients I can think of where that's happened. It's not a rapid situation. It obviously takes a good few months of doing this, and often at the end of the treatment when she's pregnant, we'll advise him to freeze his sperm, because probably this is the best sperm he'll ever have for future use. And he may go on ultimately in later life to require testosterone replacement, which his GP will monitor. So effectively there's the treatments. It's if central causes we can potentially overcome with injections. Testicular causes will require a substantial procedure called the micro-TESE. Just a gentle blockage can be overcome with a testicular aspiration. But many instances when the sperm parameters are not reaching the adequate normal levels, we will use this sperm as part of an IVF treatment, and we call this ICSI, where we actually take this sperm and inject it into the egg. Because normally with IVF, what we do is we take an egg and put about 80,000 sperm around it, and we incubate them together overnight, and it's like a competitive process, and ideally the best sperm wins. But with ICSI, we haven't got that many sperm, and we have to take a process of selecting which we believe is the best sperm, and the clever lab staff will take that with a very fine pipette, the size of a hair, and inject it into the egg. This first child was born in 1991 in Australia. There's now about 30,000 cycles a year in Australia with this treatment, and it's very, very successful. And that's called ICSI, or intracytoplasmic sperm injection, which is a very good treatment for male factor infertility.